Management of type 2 diabetes. If a patient comes to you for the management of type 2 diabetes, first you should assess whether there is any indication for insulin therapy. If it is there, you should start that patient on insulin therapy. If there is no indication for insulin therapy, you should start on non-pharmacological therapy. That includes mainly three factors there: diet control, exercise and weight reduction. If the sugars are not still controlled with these non-pharmacological measures, then you should start on drug therapy. So here I am discussing the management of type 2 diabetes using three drugs, that is metformin, glimepiride and teneligliptin. As you all know, the mechanism behind the type 2 diabetes is insulin resistance. So as the metformin decreases insulin resistance, it is the drug of choice for most of the patients with the type 2 diabetes if there is no contraindications. And the starting dose of metformin is 500 mg OD once daily. If the sugars are not controlled with the metformin 500 mg OD, then you should increase the dose as 500 mg BD. And if it is not still controlled, then 1 gram BD. Like that, you can increase it up to 3 gram per day. And if the sugars are not controlled with the metformin of 3 gram per day, either after this 3 gram dose or along with the metformin therapy, you can start on glimepiride. Start it as 1 mg OD. If it is not getting controlled, 1 mg BD. Then increase it up to 2 mg BD. Up to 2 mg BD dose you can increase without any confusions. So now it is metformin 3 gram per day and glimepiride 2 mg BD. So if the sugars are not getting controlled with the metformin of 3 gram per day, that can be 1 gram TDS, and along with that glimepiride 2 mg BD, then start with teneligliptin 20 mg OD. Now the patient is on metformin 3 gram BD, teneligliptin 20 mg OD and glimepiride 2 mg BD. If the sugars are not still controlled with the maximum tolerated dose of 3 OHs, then it is indication for insulin therapy. So I will just summarize. If a patient with the type 2 diabetes comes for treatment, then first start on non-pharmacological measures. If the sugars are not controlled with these non-pharmacological measures, then start with the metformin 500 mg OD, increase as 500 mg BD, 1 gram BD and 3 gram per day. If it is not still controlled, add glimepiride along with metformin. Start glimepiride as 1 mg OD and increase it up to 2 gram BD. And if it is not still controlled with metformin 3 gram per day and glimepiride 2 mg BD, then start teneligliptin along with this metformin glimepiride combination. If the sugars are not still controlled with the metformin, teneligliptin and glimepiride combination, then start the patient on insulin therapy. Thank you.